St. Luke's closed its school. Sacred Heart was going to close theirs. Deaconess was going to close theirs. So the Spokane League for Nursing sent Betty Harrington and me down to Pullman to talk with Dr. Terrell. We were scared to death, of course. And so we got in the car, company car, and went down, and we got as far as Colfax. And Betty said, you know, this is quite an experience we're going into. And I said, I know it. What should we do? Well, she said, there's a church. She said, up there on the hill. We could maybe pray, and I was all for it. So there we went, and we did pray. And then we went down, and I remember he was so good, very nice to us. He knew we were scared because we were asking a lot for college, you know, to take on a program like that for all of nursing in that area. And I could see him. He just sort of grinned. He said, well, girls, I think I can do that. I think we could do that. So on the way back, we were just really feeling very, very happy about that. And so we passed a little shop, and Betty said to me, well, what do you think? I said, well, I think we should. And so we went in, and we had a cocktail.
There were 4 schools in the consortium: Washington State, Whitworth, Fort Wright, and Eastern.
So in 1971, our class came to Spokane to what was known as the Intercollegiate Center for Nursing Education, and we were located down at First and Cedar in the old library.
The library has many memories for those of us in the first class. Probably the most precious memory is we, as first class members, bought a Christmas tree. And if any of you remember the old library, it had a center core that was open. And the Christmas tree that we bought for that first Christmas we were at the nursing center extended from the main floor all the way up through to the top floor.
Our skills lab was in the basement. And we had tables and chairs, as I recall, and some scattering of equipment on the tables, and that's how we learned our skills. And some of them we practiced on each other, some of them, like enemas, we didn't.
In basic nursing, we were the sim lab, so we gave each other baths, shots, started IVs, tried to put in G-tubes down each other.
And Bobby was my instructor, and the alarm and the ventilator went off. I had a patient in the ICU with a ventilator, and the alarm went off, and I, like many students, looked at the ventilator to see what was the matter, and across the room I hear a voice that says, "Stop right now." And I quickly paused, and I knew it was Bobby's voice, and she paused and said to me, "Who are you taking care of, a patient or a ventilator?"
A lot of elderly people are really afraid of machines. So my word of wisdom is turn the machines off and get to know the patient.
You just want everyone to get the best care possible, and that gives you the personal aspect.
Get involved. Get involved in your nursing association, your professional association. Get involved in politics. Find out what's happening.
Find a mentor. The sooner you can find someone after you graduate who will help you along the path to being a better nurse, the better off you are.
I've learned so much here, and I didn't always trust every day that what I was doing in school was going to translate to real life. And on the other side of it, now that I'm in real life, it does translate very well.
To make use of every moment to try to, particularly since I teach Patho-Pharm, which is usually one of the hardest courses, is to try to apply it as much as they can in their everyday life and think about it.
To any of our alumni or current students who are thinking about advancing their career, to think about including Washington State's either DNP or PhD programs.
When I came to Spokane to go to nursing school, I had no idea what to expect. And I came to a community I didn't know. I had not gone to WSU. I was a transfer student into the program from another university. I had no idea what to expect. I was living in this new city, and I remember walking into the Carnegie Library the very first day and being completely overwhelmed. The student support services at the time were amazing. Faculty reached out to us personally. They knew what was going on with us. It was small enough that we felt, I think, completely taken care of.
I would like to acknowledge the first faculty and instructors that we had. It was a difficult journey, and they worked so hard. Hilda Roberts was our first director, and Betty Anderson was the associate or the assistant director. Started out the summer, we had Charlene Clark and Shirley Jenkins, and then that fall we had Isla Olson, Gail Johns for Med-Surg, and then as a senior we had Helen Truce and Thelma Cleveland. It was an outstanding group of instructors. It must have been very difficult to start a new program and to deal with students that were unsure of where we were going and what was expected of us. But the foundation they set for my education and for others to follow cannot be duplicated.
My favorite teacher was Jan Holloway, and she has been such a role model all the way through my nursing career. I can remember her patient face. She would just kind of look at us and nod her head with a little smile, even when we weren't always quite there, and would just very calmly and preciously tell us what we needed to do to be good nurses.
Tina Bain was a good nursing instructor, and she helped you out, and they were all very friendly and wanted all the nursing students to, be supportive in whatever they were having at home, any, personal issues or things they could go up. They were very reachable, and you could always talk to whoever you needed to. The doors were always open, and they're very supportive and wanting all the student nurses to succeed and, just learn nursing and figure out what their passion was.
One was Ruth Bindler, and Ruth was the teacher who inspired me to be a pediatric nurse. And it was really Ruth's inspiration and passion around the care of children that made me want to do that type of nursing.
One of my favorite classes during nursing school was definitely OB with Cecile Oliver. She was always such a hoot, very inspiring, and got everyone interested.
I truly appreciate the instructors. I had several wonderful instructors. Nancy Davidson, Lynn Murphy, Jill Perdarvis, Tina Bain, she was also my instructor, Jan Holloway, Carolyn Hunter, just to name a few.
But another person who stands out in my head who was a good mentor and was wise because she'd been out there practicing for a while was Carol Allen. She also was the one who had nominated me for Sigma Theta Tau. I was very pleased about that, and I'm still a member.
I came to the library one day when I was in a different graduate program, and I had my little 3-year-old in tow with me at the time. And I ran into Betty in the hall, and she grabs me by the arm, and she says, "Oh, Sue." She always remembered every one of us. It didn't matter when we graduated. She knew us all. She grabs me by the arm, and she says, "You have got to see this." She says, "You've got to see this. You've got to see this." So then I went with her outside, and she hauls me out to the Dean, I think it was Dean Dustin's garden out there, and there was this poor, bedraggled, skinny, hairless almost cat they were trying to feed it pea soup out of the vending machine because it was and it was a stray cat that had wandered in, and she looked at me and she just used her Betty Anderson voice, and she said, "Sue, you've got to do something about this cat." So I took it home. And I had the cat for 14 years. But that was Betty. "You got to do something about the cat." "Oh, okay."
The first time I was in the hospital, I was in my nursing uniform, and of course we had our hats on, which I could barely keep on my head. I hadn't worn a dress probably in 5 years, and I was standing outside the classroom wondering if I should actually go in, or maybe I should just go study cosmetology or something. And I hear this old gentleman say in this really fragile voice, "Nurse." And so he's calling for a nurse, and I'm looking for one. And then I realize he's talking to me. And I think, holy cow. So I didn't know what else to do. I just went into his room. And I realized very quickly that what he needed was something very simple.
Again, another clinical experience. I had a patient I was a student, and she was a Wild woman all night, crawling off the end of the bed, jumping out of bed, doing all kinds of things, hitting nurses, trying to bite nurses. So I went in, and of course they gave the student nurse the wild person, and gave her glasses, put her teeth in, gave her hearing aid. She never said another word. She talked to me like she was what she was, which was an elderly person who needed assistance. So use your eyes, your ears, your smell, sense of smell. It all comes to, and leave the machines alone.
I have never regretted getting a nursing education. You know, there are people who will say, oh, well, you know, if you don't work on the floor or you practice in some other realm that's not commonly thought of as a nursing career, you know, what a waste of an education. And it has never been a waste. The things that I learned how to think, thinking systematically, thinking holistically, thinking interdisciplinary, and making informed decisions, not subjective or opinionated, you know, decisions about care and treatment, has been, it helps make me who I am.
I just have a lot of pride now as I see the College of Nursing on the WSU campus in Spokane, and how we've evolved to such a program from our humble beginnings, and have all the technical support and systems that help support the students in the program.
The foundation that was set by the Nursing Center helped us to impact the Spokane and other medical communities with success. I'm very proud of the Intercollegiate Nursing Center, or the College of Nursing as it is today.
We really were pioneers. We were all, you know, and they're still pioneering in some ways in wonderful programs that they're developing. Nursing is a very beautiful profession, and I just have loved it.